Hello everyone, Dr. Cervone here with Cumberland Chiropractic and Sports Medicine. We're always doing these videos talking about different conditions we treat, different rehab exercises for those conditions. But one thing we never really talked about is the behind the scenes stuff, that once you're a patient here at the office and you've been treated by us, what do we do afterwards when we're done with treatment? We have all these adjunct therapies, all these modalities that we use for your problem to get it better faster, to speed the process up. So that's what we're going to talk about today. We're going to show you all the different options we have, so stick around and see them. Okay, so probably our most popular modality that we use is our therapy laser. Now this is a class 4 laser. Basically just means it's hot. There's two different types of therapy lasers. There's one that's cold, doesn't produce heat. There's one that does produce heat. That's what we have here. And what the laser is going to do is it produces frequencies of light that penetrate down into your cells. They get into those cells, they get into the mitochondria of those cells, and they speed up the metabolism. And what does a speed up metabolism in a cell do? It increases its reproduction, it increases new cell growth. So that's what we're using this for. We're trying to heal some of that damaged tissue that we're working on. So we can use it for chronic conditions, old injuries and things that we want to stimulate some healing on. And we can use it for new injuries too, acute stuff, the really inflamed stuff, to decrease the pain, decrease inflammation, and stimulate some healing on that. Okay, the second thing we use quite a bit of is we have these massage tools, these massage machines we like to use. So the first one is just kind of this vibration plate massage tool. So what this is going to do is when we turn this on, this big plate starts to shake pretty good, and we can crank the speed up or down to whatever's most comfortable. But what we like to do this for is if you have a really painful, tight area, we can set this massage plate on here, and that shaking, it's kind of like if you hit your thumb with a hammer and you start to rub it, that sensation of rubbing it kind of makes the pain go away. This does the same thing. It kind of shakes up that area and decreases the pain, but that shaking will also cause that muscle spasm, that tight muscle, to kind of relax a little bit. The same thing can be said for our percussion massage tools. The difference with these is instead of shaking side to side, this little plunger pushes down into the muscle, and what that's going to do is it pushes a little stretch on that muscle and causes the muscle to contract and relax very quickly, and that repetitive contract and relax thing makes the muscle kind of calm down a little bit. What I like to do personally with these things is I like to do what I call dynamic vibration or dynamic percussion massage. So I'll turn this on, I'll put this on a tight muscle, and while I'm kind of pulling one way, I like to contract the muscle and move tissues in different directions so we get this kind of tissue sliding effect. All right, one of the other things we like to utilize in our office sometimes for those really tough, like acute cases, if I can't get my hands on something that's so sensitive to touch that I'm not going to be able to get any work done, we like to use our E-Stim machine. It's kind of like your at-home TENS unit. Most people have experienced something like this before or kind of know what it is. We use these sticky pads to kind of put them around the area. We hook it up to these wires, and these wires go to the machine, and what this is going to do is, what pain really is just an electrical signal from a painful area, a damaged area, to your brain. And what the machine does is it puts an electric current into that area, and it kind of cancels out that painful electrical signal, and it can calm down a lot of that really sensitive skin area, muscle pain, nerve pain. We might even put some ice right over top of this just to try to numb the area down. That's going to reduce your pain a little bit anyways, but then it allows us to get our hands on that and really get our treatment done. Okay, we're going to kind of lump all of our other stuff into one last category here. So one thing we do a lot of is taping, kinesio taping. We like to use this rock tape. So most people have seen the tape. Again, it's very stretchy, elastic sort of tape. And when we put that on an area, we can use it to facilitate muscle contraction. The stretch of the tape as it contracts will facilitate a muscle contraction. So if I want to work more of this forearm, if I want someone strengthening this part of the forearm, I might put tape here on the front of the forearm so it facilitates the contraction. If I don't want them extending, I can also inhibit some things. So if I don't want them extending, I might put tape here so they don't extend their hand. Every time they go to extend their hand, they feel the tape stretch, and it's a constant reminder for them to not do that movement. Same thing for like the low back. We're gonna put tape on the low back, so if you're not supposed to be doing a lot of bending forward right now, you bend forward, you feel the tape stretch on the back, and it makes you sit up straight. and it kind of provides that sensory feedback to the skin too, just like the hammer and thumb analogy. You hit your thumb with a hammer, you kind of rub it, it feels better. The tape over top of the skin kind of blocks some of that pain signal. A couple of other things we like to do is cupping. Now cupping, a lot of people have seen that where people have the big bruises on their back and things. I don't like to do a lot of the static cupping. I like to do, again, dynamic cupping, just like our vibration. So we have the rubber cups, and we do have a glass kind of plastic cupping set. I like these rubber ones because I can put them right on pretty much any area, provide some suction, and then I can do my muscle contraction, my tissue movement while this cup is kind of pulling up on that tissue, and we're getting some tissue sliding there. We can do the same thing with these floss bands where we wrap an area of the body up. So I might wrap my forearm all the way up. It provides some good compression in that area, and I start to do muscle contraction and slide those tissues through there. This is really good for acute inflammatory like ankle sprains, joint sprains. It really kind of squeezes all that fluid out of the area, so then you can provide some movement to that area and help rehab it a little quicker. The last thing we'll do in our office, and Dr. Moore actually does all of it for us, is our dry needling. Great for old kind of chronic injuries to stimulate healing to the area, and we have a whole video on that. So if you're interested in dry needling, we'll put the link to that video and go watch that one. But if you have any questions about any of these modalities we kind of talked about today, leave a comment, ask us a question, call in the office. These are just all different ways that we're trying to speed your healing up, and we'll get you better faster.